Snoring that disturbs sleep or stops breathing is not normal. It may be a sign of sleep apnea, a serious sleep-related breathing disorder. Sleep apnea occurs when breathing repeatedly stops and starts during sleep due to airway obstruction. It is commonly caused by anatomical airway narrowing, excess tissue, or obesity. An ENT specialist plays a key role in evaluating snoring and diagnosing sleep apnea. At Olive Hospital, we provide comprehensive ENT-led evaluation and evidence-based care for sleep-related breathing disorders. Do not ignore persistent snoring. Consult an ENT specialist at Olive Hospital.